Hey, everybody. Welcome to my little free mini webinar on cooperative care. This is all about getting started on the right track with the training that you'll need for veterinary care and grooming. So, first, let me introduce myself. I'm Deb Jones. I have a PhD in social and behavioral psychology. I'm a retired psychology professor. I taught for 20 years, a variety of courses. I'm also the author of 13 dog training books. I've been a trainer for over 30 years, and I consider myself to be a positive reinforcement trainer and educator. And I now work pretty much exclusively online through Fancy Dog Sports Academy. And if you'd like to meet the one who started this whole process for me, this whole journey in cooperative care, that would be Star. And you can see Star is very clearly showing us how she feels about being restrained. Okay. So most of you are here and looking at this little webinar because you have an animal who's uncomfortable with physical care. And for me, that was Star. She had a bad vet experience when she was about a year old, and that just spiraled and very, very quickly into a dog who was like, there is no way. There's no way that strangers are handling me and restraining me. It's not going to happen. Of course, I knew I had many, many years ahead with a dog who needed to be handled and be comfortable being handled. Star's now 13 years old. Her birthday's coming up in a few days here. And I would say she still doesn't love a lot of things, but she tolerates a lot of things. And sometimes tolerance is a great goal. Tolerance can be enough. So let me talk a little bit about just the basics of cooperative care as I see them. Okay. So what is it? Sometimes I use the term husbandry when I talk about cooperative care. The idea that that our animals, the animals that are in our charge, have physical needs that must be managed in some way, so that we need to physically do things to them to make them comfortable and to keep them healthy. So we often also talk about it as handling, physically being able to put our hands on an animal and to be able to do that safely in particular. Grooming and physical care, these are going to be throughout your dog's lifetime. You're going to have to do all kinds of little procedures as you go along through your dog's life. The simple things like brushing and doing nails, which turns out to be a very difficult one in some cases. And also for any veterinarian medical procedures, there are going to be many, many things that possibly need to be done. And you don't know you need them until you need them. So doing a little work proactively to get our dogs accustomed to different types of restraint and handling that are common in veterinary procedures is really a helpful thing to do. So my basic approach to cooperative care, first of all, emotions matter. Our primary concern is with our animals being comfortable as possible and being calm as possible. We do the best we can to maintain those emotions through the process. Okay. Then we need to identify and use food reinforcers, and we provide them in a very specific way to encourage stillness and relaxation. I often talk about Zen exercises, and Zen has to do with a particular way of using food and feeding our dogs that keeps them at a lower level of arousal rather than a higher one. Third, identifying a specific place to do this work. I use a grooming table that sits in my living room all the time. If you don't have space for a specific item like a grooming table, you can use a mat or a rug or some play tiles. A yoga mat is a common one that's used. Whatever the surface you use, it needs to be stable and secure. Okay. Definitely not slippery, definitely not something that's going to move in any way. If you use a mat or a rug, I often add this to my grooming table to make it even more secure. Plus, then you have something that you can travel with and take with you to the vet, for example, that's familiar to them in terms of connecting it with your cooperative care work. But you do need a place to do this work. And this place, you're always going to make it pleasant and a good place for them to be. Okay. Fourth, We want to teach our animals that touching is good, that our hands on them always mean something good is going to happen next for them, typically cookies. So touching is a good thing, and humans touch animals lots of times in lots of different ways, and it's not scary. It's nothing to be concerned about. It's just kind of part of day-to-day life. Fifth, learning to read your dog's body language for signs of discomfort or stress. Sometimes these signs are very small and hard to see. Other times they're huge and obvious. If your dog leaves, that's a big sign that they're uncomfortable. If your dog growls or snaps, that's a huge sign that they're uncomfortable. So stop doing what you're doing there. They've communicated that very clearly. But lots of times there are lots of smaller precursors, ears pinned back, panting, tenseness of the muscles, tail goes down. There's all kinds of things. And different dogs tend to have different patterns that show their their discomfort. So watch for that with your dog. When you see that, you know you're pushing too hard and too fast and you need to back off. However, number six, as your dog remains comfortable, you can increase challenges and go beyond what you're doing at the current level. You can do more, but only as long as your dog is relaxed and comfortable with it. Okay, so my four-step foundation for cooperative care success. So I mentioned finding a place, establishing a place to do your cooperative care work where your dog is very comfortable and they're very happy to be there. Second step, Zen feeding, using food in such a way that it encourages more calmness and relaxation. And I know for some dogs, you might be thinking, oh, food always makes my dog excited. We have exercises to calm this all down. Okay. Third is stillness. Trying to work with a moving target is very, very difficult. And some dogs are very twitchy and antsy and move a lot. We want to encourage just the opposite. Just hold still. I will do the things to you. You don't have to do anything but just hang there and relax. Harder than it sounds. And then touch. Can I touch my dog in a variety of different ways on a variety of different body parts? And you will see that some parts are probably much more sensitive than others. And so pay attention to that because there could be physical pain there, or there could be the expectation of pain or discomfort. So pay attention to how your dog responds to your touch and different body parts. So, the most common cooperative care procedures and the ones that people ask about most regularly, I'd say number one by far is nails. Trying to do a dog's nails can be a very difficult prospect indeed. And oftentimes you don't know you have a problem until you have a huge problem with nails. And this can take a lot of time and effort to counter condition, but we can do it. Ears are often sensitive, and ears often need to be medicated or cleaned. So it's not something we can ignore many times. The same with eyes. Eyes often need drops, okay, and they need to be examined. So getting dog used to having their eyes dealt with in some way. The fourth one I have here is teeth, okay, getting teeth brushed, getting teeth cleaned, checking teeth. Um, the fifth is giving medication, both in pill form and in liquid form. There are definitely ways we can teach our dogs to be fine with this and to actively take part in taking their medication, but we need to introduce it before we start trying to shove pills down their throat. And the last one is blood draw. You could also think of injections as well along the same lines here because we're dealing with syringes and sharp, pointy things, but we can definitely teach our dogs to tolerate these kinds of things without much of an issue. Okay. So those are some of the common procedures that we often talk about and work through. Something important to keep in mind always is that your dog gets the right to say no. It's cooperative, meaning you both have to agree to do this. And if your dog says no, listen to the no. Don't strong arm or pressure your dog into something that's not absolutely necessary. I'll mention more about that in a second. But just because you can do it doesn't mean you should. So listen to your dog, pay attention to their signs of stress, be very observant and sensitive to those. Stop what you're doing if they're uncomfortable, or move to an easier level so they can be successful and gain their confidence back. And pushing too hard almost always leads to regression. So if you push too much, you end up going backwards. And then you have to regain that lost ground and that lost trust, which is difficult sometimes. So you're better to do less if you're not certain or if things don't seem to be going great than to push and try to do more. So, how do we get our dogs to agree? How do we get that cooperation and get them to say yes more often? First of all, we slow down the process. You're going too fast. I don't even have to see you working with your dog. No, you're going too fast because almost everybody does. We need to break it down a little bit here. So accept your dog's no and think about what you were doing when your dog disengaged or left or indicated they were uncomfortable. Okay? And come back at an easier level. We take a calm and relaxed approach to this. Slow, easy, gentle. Okay. Because that's the internal state we want our dogs to have. So we need to mirror that for them. Also, we're going to break things down into small little pieces and we're going to go backwards from wherever you are. Wherever you are is not working, we need to go backwards. We need to break it down into tinier little parts, and then we can move forward and make progress again. And this is something I think I'm pretty good at. I'm pretty good at going, okay, here, we can split this even further. Because you'll say, well, I can do this, but I can't do that. And usually there's like 3 or 4 steps that you're missing in between there. And we can identify those for you and help you move through them. Okay. And if we have to go backwards, we go backwards. We go back to the point where our dogs can be successful, and then we move forward again. Okay. So, how do we get started? You choose your cooperative care place for training. Okay. You gather your high value food reinforcers to use. Um, you introduce and practice the Zen food exercises, right? We're feeding for stillness. We're doing touching and treating all over the body in a variety of ways. And then we move to focusing on specific body parts and procedures such as trimming nails or putting drops in ears or whatever the case might be. Okay. So we have a number of steps that we're going to move through here. And if you do all these foundation steps well, the other things that are harder suddenly become much, much easier because you've developed and established kind of your dog's confidence and trust. And that will let us then move ahead even more. Okay. Now, sometimes you get in a situation where something has to be done now. So, is it a physical necessity? Do we have absolutely no choice? Okay. If that's the case, I try to change the context from my training context. So, that place I've established for cooperative care, I don't want to use that if I'm going to be doing something forcefully that must be done. I want to change context, do it someplace differently. I don't even bother with training or food. If this just has to be done, it just has to be done. I don't want to connect it with my training or with the food because we can do what's called poisoning the cookies. So then our dogs become suspicious whenever we bring out certain types of food or any food and want to do cooperative care with them. So it's better to keep that separate. And I want to get them in and out of this situation as quickly and as calmly and as neutral of a manner as possible. If they have to be restrained, they have to be restrained. I'm not going to try to lure them with cookies. I'm just going to restrain them, do the thing, and be done with it and move on. Okay. Now, that's only if something really, truly has to be done right now. It has to be done. That's life. We run into those situations sometimes. But if you have the opportunity to prepare it all, say you have a vet appointment in 2 or 3 days, okay, and you know that they're going to have something done. You can practice your approximations in multiple short sessions. Introduce restraint that gets reinforced. I do tons of, with my handling and touch comes restraint, and they get reinforced all the time. They get lots of food for that, so that it's like, okay, they grab me, they hold me, I get goodies, it's all good. It's all fine. So I want them to feel like restraint is okay, restraint happens. Okay. and introducing a non-optional cue. Sometimes it's best to be clear and just tell them, you don't have a choice here. Don't want to lie and pretend they have a choice and they can opt out, which we do in training sessions, which we should do. We don't want to pretend they can do that if it's a procedure that absolutely has to be done and we cannot stop. So a cue saying this is going to happen no matter what helps with clarity and helps them read the situation and understand the situation better. But be sure that it absolutely has to be done and do as much prep as you can. And that's why, again, doing things ahead of time is always ideal. But I know that a lot of people show up to learn about cooperative care after they've discovered that they haven't done the things that would be helpful. So we go back and we start from scratch and we work forward. You can still accomplish a lot. The good thing about training for cooperative care is that it has this wonderful carryover effect. It's often a pleasant surprise to people. Any cooperative care work you have done in the past makes other handling easier in the present and future, even if you didn't do this exact thing. Okay? So even if you have not totally prepared for something, a decent foundation can get you through new husbandry procedures. So everything you've done in the past, never wasted because it carries over. And you'll find in new situations where you didn't expect it, you get benefit and you get results because your dog's so used to, well, they do stuff to me and it's okay. That they are very compliant, even about new things or even about things that you're worried they're not going to handle well. So we get carryover effects sometimes, and that's a great thing to have. To finish this up, I'm going to give you a little quick tutorial on something. So I just picked injections. Because most all dogs will get injections at the vet. So the things to think about, the things I think about if I'm thinking about preparing my dog for injections. Number one is positioning. What position are they going to be in to get the injection? What physical position? Sit down, stand, lying on the side, on their back, whatever it is. Then I need to think about getting the position and then getting stillness in that position, or if necessary, if there's going to be restraint, practicing restraint in that position. Okay. Thinking about the injection location, I want to know where that's going to be so I can start approximating it and practicing it. And then working on the tactile sensations that go around with those places. Okay. So I'm going to show you first one video of these steps, and then I'm going to go on to some more specific steps after this. So let's look at this first video. Oops. Injection tutorial. All right, so I wanted to show you a quick little tutorial on some of the things I would think about in preparing my dog to get an injection. Okay. And so Wizard's going to be my helper here for this. The first thing would be how the dog will be positioned, and that depends on the location of the injection. So let's take a look at this. My dog could either be in a sit. Oh, I guess he heard that. Or he could be standing, depending on where they want to give the injection. A lot of times you get injections like between the shoulder blades, right in here. Good. And that's, so a sit would be fine for that. If the injection was going to be in a hip, then I'd want to move my dog into a stand. Come here, stand. Good. So that it would be easy to access the area like along here of the hip. Good. So I would ask the vet about positioning. What is going to be the easiest position for them to do the injection, depending on what they do. Then I want to work on also stillness in the location or in the position. Okay. So just getting him into a stand, for example, just it stands a little harder, and feeding him there to keep him settled. Good. Good. Okay. Good. So getting some stillness in whatever position I want my dog to be in. And then I can add in a little more handling in terms of the location. So I'm starting to pull up the skin a little bit here and pinch a little bit. Good. As I see that my dog is comfortable with this and they're not having problems, I'll add a little more intensity. Good. So I'm pulling pretty hard there, and he's just waiting because he knows it's going to lead to a treat. Same with the hip. I might do a little bit here, good, just to get him used to having that area handled. And then I would do a little more, a little pinching and pulling, good. As long as my dog is comfortable, I will continue to do that. The other thing I often do for injections is before the injection, I want to rub the area crosswise, kind of vigorously. I would do this while we're waiting to get the injection, just to kind of activate all of these nerve endings, especially up a little higher between wherever the injection is going to happen in the brain, okay? I would activate those nerve endings a little bit so that my dog would it kind of breaks up the sensation that happens later on down here. So it can't hurt, might help. Okay. Good job, Wizard. Thank you for your help. Okay. Okay, so those are the main parts that I'm prepping for those 4 steps I talked about. Okay. Then we would think about, okay, how can I actually replicate the injection itself? I need something to substitute for a syringe, and in the video I'm going to show you, I just use a pen. You can use anything. You can poke them with anything as long as you don't want it. You don't need anything sharp. Let me point that out. Now, I do have a lot of syringes that don't have needles in them, so I could use that as well. But anything that we're going to poke them a little bit with, and it doesn't have to be a sharp thing. So we're going to introduce this tool. We're going to touch them with it. We're going to poke them with it. And then as a final step, I'm going to tent the skin, which means pull it up away from the body and poke them with this tool that we're using as a substitute syringe. Okay. So here's a little bit of video looking at that. All right. So to finish up on this tutorial on injections, the last part of it would be to do some sort of substitute for a syringe and play around with that. I happen to have a pin here that I might use common around the house. I also have my insulin pins that I could use, but that you don't have to have a syringe necessarily. If you have one, great. Okay, Wiz. Good boy. Okay. So I've gone through all the steps to getting him ready. The last step is to introduce the tool that you're going to use as a syringe substitute. Good. So I want him to see it, not necessarily react to it. Good. Touch him lightly with it. Oop, did you drop something? We always have to go get our cookie. Star, go lay down. Wizard, come up. Good. Right. Touch him a little harder. Good. Think about how they're going to handle him. Probably pull up and tent the skin a little bit and give the injection. Good. Okay. So I can easily replicate that. Good. With everything except the actual needle. Same back here. Good. Okay. So I can replicate it to a great extent, and you will get some of that carryover effect. Good. So I wouldn't worry too much about doing the actual injection, just all of these little steps leading up to it. Well done, Wiz. Okay, so that was a little bit about one small procedure that I would work on to prepare my dog for. Okay. So thank you for being here for my little mini webinar and watching. Some additional resources if you're interested in learning more. Join my Cooperative Care with Deb Jones Facebook group. Lots of free advice and support and feedback and troubleshooting and problem solving. Some great people in that group that are very, very helpful. And if you want more resources, then we can provide them there as well. I can tell you about all the resources we have. My once-a-year class through Fenzi Dog Sports Academy online is called Yes Please Cooperative Canine Care. It's 6 weeks and it covers a huge number of things in that 6-week time frame in terms of all of the different procedures and how to get them started. And the book, Cooperative Care, 7 Steps to Stress-Free Husbandry, most easily found on Amazon. Through Dogwise as well. So the book lays everything out in text and pictures if you're somebody who learns well that way. Okay. I also do a number of workshops and webinars through Fancy Dog Sports Academy throughout the year having to do with cooperative care. So I would like to thank you very much for spending this time with me and get training. Thanks.